ملتقى اليوم واليوم الثاني للملتقى مع الاستماع إلى عرض توضيحي من السيدة كاتيا أوتمان مدير السياسة العامة لشركة روش في الشرق الأوسط. وأيضا بعد ذلك سنستمع إلى عرض توضيحي من السيدة شيماء لاشين مدرس علاج الأورام كلية الطب القصر العيني، ثم آخر الجلسات الجلسة الرابعة. الآن نستمع إلى عرض توضيحي من السيدة كاتيا أوتمان مديرة السياسة العامة لشركة روش في الشرق الأوسط.
Good afternoon, and thank you so much to the organizers for inviting me here today. I must say it's always such a pleasure to come to Egypt. The first time that I came here, I actually came for my honeymoon, so it's a very special place for me. And you may not be surprised, but I actually named my daughter Cairo. I suppose maybe I should have put a photo of her here. Anyways, I'll take about 10 minutes if that's fine with you. I'd like to acknowledge the role that Roche Pharmaceuticals is playing with corporate social responsibility. My name is Katia Oatman. I am the Director of Public Policy for Roche in the Middle East. If you're not familiar with our company, Roche is a global biotech pharmaceutical. We make groundbreaking advances in medicine, most notably for cancers, but also for other serious diseases, such as MS, rheumatoid arthritis, very recently for hemophilia. We also have a large clinical development program where we are pursuing innovative technologies for other serious diseases, such as Alzheimer's and rare genetic diseases. But groundbreaking advances in medicine are only meaningful when they can actually reach patients. So our aim at Roche is to enable every person who needs our medicines to be able to access them and benefit from them. And therefore, we feel that it's not just enough to develop these innovative technologies, but actually to be part of the larger healthcare system and to support developing and supporting patients to enable access to these medicines. And this isn't easy, of course. Access to healthcare is a multidimensional challenge. What we have done at Roche is identified 4 areas where we feel that we can make a difference and a contribution. The first area is awareness. One example where we're contributing for awareness is with a broad program in Saudi Arabia to help patients with breast cancer screening programs through mobile screening units. The second area is diagnostics. An example where we're contributing there is in Southeast Asia. There's a program that Roche contributes to called the SPHERE program. This program helps to train pathologists and other healthcare workers on the very complex diagnostic process of determining specific genetic types of breast cancer. The third area is healthcare capacity or capabilities. Globally, we have ongoing support for the training of healthcare professionals. And in certain regions, including Egypt, we support with actual healthcare equipment, most notably diagnostics and test kits. And finally, the area of funding, potentially the most difficult. We at Roche partner directly with governments, including here in Egypt, to try to identify how we can bridge the financing gap. Financing for healthcare is a wide global problem, and we want to reduce the burden on patients. Healthcare challenges vary greatly from country to country. Unfortunately, it would be nice if there was a one-size-fits-all approach, and there isn't. To date, today, there are still over 400 million patients who don't have adequate access to essential healthcare. And this can be for one or more of the 4 factors that I identified my previous slide. I think one of the previous presenters had a slide of the UN Sustainability Goals. Number 17 highlights the importance of partnerships, and this is key to the work that we are doing with Roche in corporate sustainable development. We partner with many of you in this room, those of you who are academics, who work for private organizations, government, other healthcare organizations, and NGOs, just to name a few. And I'm very pleased to let you know about an initiative that Roche has spearheaded that was announced just 2 months ago at the World Economic Forum in Davos, Switzerland. This is a partnership between 22 different pharmaceutical companies, the World Bank, and the World Health Organization. And the platform for this initiative, called Access Accelerated, is to support patients with non-communicable diseases, especially patients with cancer and diabetes. The first initiative of this partnership has been announced. There will be the development and the creation of 3 cancer centers of excellence in 3 different cities globally. Now, this is just the first announcement. There will be more cities named and more initiatives. But the point of this is that we feel it's absolutely crucial that we work in partnership, and we help actually even develop these partnerships between stakeholders so that we can find sustainable healthcare benefits for patients. I'm going to now describe 2 very specific partnerships, one in the Far East and one that's here in this region. The Action Study in Asia. This is a partnership. And the rationale for this partnership is that in Southeast Asia, the economic burden of cancer on households was not widely understood. And without this evidence, it was very difficult for policymakers to prioritize cancer or put effective policies in place to help patients. So Roche partnered with 47 experts in 8 countries, as well as the global policy, the George Institute for Global Policy based in Australia. And those experts investigated what the out-of-pocket costs were for patients when they were diagnosed with cancer in the region. And they also evaluated the overall survival rates. The impact of this partnership was very impressive. 8 countries have now prioritized cancer, and they've been able to put evidence-based policies in place to support patients. A little bit more detail about this study. It involved 8 countries and over 9,500 patients. Patients who were enrolled had a first-time diagnosis of cancer. They were receiving healthcare services in both private and public facilities, and they were followed for a 1-year period. The experts investigated what was the overall out-of-pocket expenses that these people spent. And if it was 30% or more of their household income, they met the definition for financial catastrophe. The authors also looked at all-cause mortality. The results are devastating. After 1 year, more than 75% of the patients enrolled in this study had either died or had financial catastrophe. Only 23% of the patients were alive without financial catastrophe after 1 year. And many of these patients also reported having significant economic hardship. For example, they reported not being able to pay their rent or not being able to pay for their children's school fees. And the ASEAN Foundation responded in kind. There was a declaration for cancer control developed by these experts and policymakers in the region. This was adopted by the ASEAN Task Force for Non-Communicable Diseases, and recommendations were made to member countries to develop cancer registries and comprehensive cancer control plans. And member countries responded, either by developing cancer registries, eliminating expensive taxes on cancer medications, or initiating cancer control committees or national cancer control plans. A second partnership, this one is included here in the region. It involves 6 countries: Egypt, Jordan, Oman, Kuwait, Saudi, and the UAE. This particular study is focused on health system strengthening. And the rationale behind this partnership is because breast cancer is a huge issue in this region. It's expected to double by the year 2030. And Arab women face a particularly aggressive type of breast cancer. They are often younger when they fall victim, and they present late in the disease stage, which makes it much more difficult for the patients to be treated effectively. The partnership is with 22 experts in these 6 countries, as well as the Harvard Chan School of Public Health. These experts are investigating the health systems in these 6 countries and identifying where there can be improvements made to prepare for this alarming increase of breast cancer and improve the outcome for patients who suffer. At the end of the year, Harvard and these experts will have a comprehensive list of recommendations for these 6 countries. And this is where Roche can step in again as a partner to help implement those recommendations. So in summary, access to healthcare is a priority for Roche. We feel that it's not enough just to make innovative medications and technologies. We feel it's our corporate responsibility as a leader in healthcare to be part of the larger healthcare system, to partner with those other stakeholders to find solutions for patients. It's a multidimensional challenge, but we have some systematic and comprehensive approaches to this. And certainly, when we work with all of you in the room, we feel that we can develop tailored solutions to help meet patients' needs. Thank you.